We are more than halfway through the module. Welcome to week 6 of HIT 500 Health Statistics. And I hope you're sitting there looking at yourselves because y'all did really, really well. Okay. And patting yourselves on the back. I do see that question. I will be asking Mrs. Cotton, but she'll be here, so you'll be able to ask her that as well. But just in case you forget, I will make sure to just let her know because we are health statistics class, so ours is slightly different than the other courses with our formulas and our more word problems that we have to dive into. So I'll definitely bring that up to her if it is not brought up when she is here. A great question. Okay, so tonight we're still going to do our math trivia. We are covering chapter 6, mortality rates, as well as chapter 7, hospital autopsies and autopsy rates. Keep working on your knowledge checks, and your preview of this week's apply and reflection activity is already up on announcements. But that does not mean if there's something that I did not touch on in that preview, and most likely we probably won't be able to get to everything this evening, y'all let me know. Okay, if that means that I do another video or like something mini to give y'all that information so that you do have that as you get ready for your final, that's what I'm here for. Okay. Again, Miss Cotton is scheduled to arrive around 5:30-ish, and she's going to give us a lot of updates on the upcoming modules. Now, remember, okay, participation in the live sessions is going to be one of those topics that's going to be brought up, and it's extremely important. We really want the program to be a success, right? So we are going to be looking at our session logged in times a little bit more closely. But why do y'all think the live session participation, if I can get the words out, is so important? Like, why do you think that that's something now that we're looking at? Not that we weren't looking at it before, but to stay engaged. Excellent question. I mean, excellent answer. Question. Excellent answer. Yes. The live sessions are really just instrumental in just being there for y'all. Like if y'all have questions for me, if there's some concerns, just like with the midterm, not even the midterm, questions in general, especially for health statistics. Being here, I'm able to kind of write it down because, I'm getting wiser in my age. And I'm able to um, get the information to who it needs to be to and get it back to you. Now, if you are driving, that's different. So what we're looking at, and Miss Cotton is really gonna be able to let us know everything, is if you're driving, that's different. Like we do not want y'all to be in an accident or anything crazy like that. But being able to still have questions. There's many a times when there's something that you may say, hey, I do need a little bit more information on this. And if I'm not able to get it to you, let's say in the live session, and I can only speak for myself, y'all, but I will try to do my due diligence to get that information to y'all because I was a student. I know how it is. And it's the same with like our cameras, right? So I was that student that probably will pop in and out, right? As long as you're engaging like you guys do. We do our poll questions, we do Quizlet, we do different things to keep y'all engaged. Again, I can only speak for HIT 500 or HIT 410, the courses that I teach, right? And it's just really just getting you guys more opportunity to see me as a resource. Okay. Now, with that, just a heads up, if you are popping in and popping out, and I'm not talking about computer issues because I have computer issues where I'm like, you'll see me and then I'm gone, and you'll see me and then I'm gone. That is completely different. We're going to be looking at if you pop in and then you're ghosted and you're never back in. Okay. That's completely different. Like if you're driving, if you're at work, that's different. Okay. So I love how you said to stay engaged because that's exactly the biggest thing. We want you guys to be engaged and know that we are here for you if you need anything. Okay. Now, I get it. Okay. Change can be nerve-wracking, and I think we talked about change management in 410, but I'm confident and I trust that these updates that Ms. Cotton's going to go over is going to make it better for all of us. She will be able to kind of hopefully put everybody at ease when it comes to the new updates. And it's going to give us that opportunity just to see how these changes can really enhance our educational experience. So, with that, she's going to pop in. So, we'll be able to get all that out of the way. For those of you who are watching the live session from chapter 7, we're going to be covering hospital autopsies and autopsy rates. What factors do you believe contribute to the varying rates of hospital autopsies? And what might these rates have on medical practices and patient care? Like, what impact do you think they could have? It could be from maybe you don't want to go to that particular hospital, or maybe there's something about the types of autopsies being done. But let's talk about that in the discussion forum. Math trivia, kind of shake us up a little bit. Now, this one I found very interesting. What is the only prime number? The only prime number. It's 2. So in mathematics, a prime number is just a natural number greater than 1. And so before I looked it up, I was right there with you. I was like, it got to be 7 or something higher, right? It's 2. We have typically prime numbers are odd, right? But 2 is that one exception. 2 is the only even prime number because it's divisible only by 1 and itself. And it happens to be the smallest prime number. All other even numbers greater than 2 are divisible by what? By 2, as well as other numbers, making them composites rather than primes. And I thought that was really cool when I looked that up. Math is the language of the universe. So the more equations you know, the more you can converse with the cosmos. Just a little something to kind of break up all the monotony. Okay, so again, we're going to see how far we get. And then when Miss Cotton pops in, do not stress. I'm still going to give you all of this information. It'll probably just be in a video that I'll send to you later. So just keep that in mind. Okay, now, chapter 6, mortality rates, or you may see mortality rate, another name, death rate. Hint, hint, you may see that. All right. And it's going to just be the measure of the number of deaths. In general, it's going to be due to a specific cause, though. We're going to also look at particular populations. They're going to be scaled to the size of the population and then per unit of time. Now, there are a lot of terms in the 2 chapters that you're going to have to just read on and make sure you have a good understanding, because they will populate on this week's quiz and of course on your final. Again, I'm giving you guys that Quizlet earlier just so you'll have that information a little bit sooner. Now, going straight into it, we look at mortality rate, okay, the proportion of inpatient hospitalizations that end, unfortunately, in death, usually expressed as a percentage. Okay, so then you look at your gross mortality rate. In the very first example, if a hospital had 7 deaths and 520 discharges, that includes deaths for a month, what is the hospital's mortality rate? We get down to this last section right here, and we're still talking about rounding to the nearest 10th, okay? So we go ahead and put up that hospital mortality rate. We have 7 deaths over 520 discharges, 7 over 520, giving us 0.13, yes, 0.134 or 1.3%. And I love how you wrote that because, again, rounding to the nearest 10th. So here we're going to really have to pay attention if they say tenths, 100ths, or even 1000ths, okay? Because this is the section that they, depending on your facility, that's how they're going to want to look at it. Couple more examples. Example 2, if a hospital had 40 acute myocardial infarctions or AMIs, discharges, and that includes deaths. Last year, and 8 deaths, what is the case fatality rate for an AMI? Here we look at the case fatality rate formula. And don't worry, I have this already. I think I sent it to y'all already, I believe. I tried to do it earlier today, so you guys had it. I think I did. Number of deaths for patients with diseases during a period over number of patients discharges with disease, including deaths during a period. And it's really funny because it's what happened to the maximum amount that could have happened. That's really the formula you're going to be needing for your RHIT exam as well. Okay, so we had 8 deaths. I'm going ahead of myself, guys. There we go. Over 40, because that's the potential that could have happened. You put it in that perspective, like 8 did happen, but with 40 discharges, 40 could have happened. So 8 over 40 gives you 0.2 or 20.0. So you have to put that 0. If you don't have that 0, it may not show as correct, okay? So just keep that in mind. Okay, this third one, I'm going to give it to y'all. The case fatality rate can also be used to examine the mortality rate of physicians. This is important, okay? So with a couple years ago, when everyone's going for their BBLs and everything, right? Some of the patients, unfortunately, may not have checked their doctor's records, right? And I say that because there were so many unfortunate patients that were becoming unalived because of these different procedures with these doctors that didn't have the best rates, or, So here we have Dr. Howard, okay, discharged 600 patients in the past year. And of those, that's the correct formula, patients, 27 died. The formula would be, that is correct, 27 over 600, and that's the beginning, okay? 0.0450 or 4.5%. That is correct. Yep, and no preoperative clearances. Yep, that's another one, big one. And then you wonder who the anesthesiologist they sign up. We could go down a whole rabbit hole, but yes, we get example 4. So as you can see, after week 6, it's a lot more formulas. We're going to do a lot more examples, okay? In example 4, we look at net mortality rate, all right? Again, number of patients, number of deaths, inpatient deaths, minus number of inpatient deaths within 48 hours. And whatever we're doing in the numerator, we're going to do again in the denominator. So last month, community hospital had 250 discharged, including 9 deaths. So in our mind, we're like, okay, we're going to start getting this together. But keep in mind, when we talk about net mortality rate, we are not including the patients that died within 48 hours of admission, okay? So that means we have our net mortality rate, 9 minus 3. Whatever we do on the numerator, we're going to do it again on the denominator. Remember, 3 deaths were patients who were in the hospital less than 48 hours. So they do not count, okay? So this is kind of how we're setting these up, which gives us, and remember, still check my work, 0.0238, or that 8 has that 3 become a 4, rounding up to 2.4%. So in this particular instance, the net mortality rate is 2.4%. Now, this next one I don't really like to talk about, being that, I like to be in the operating room. This is something that we don't really like to have, okay? Now, postoperative mortality rate. So you see where we're going. Where are we at? We're looking at positions. We're looking at areas. It could be emergency room mortality rate. It could be oncology mortality rate. Dr. Howard mortality rate, okay? The only difference is we're not looking at a whole big thing. We're just looking at specifics. But you can do a whole hospital. You can say community hospital mortality rate, okay? So in this instance, we're talking about postoperative mortality rate, total number of deaths within 10 days of surgical operation in a period over total number of patients experiencing a surgical operation in that same time period. We get in example 5, 123 patients were operated on in the cardiovascular clinic at University Hospital. 3 of those patients died within 10 days of their operation, so they're still considered a part of that post-operative time frame. What is the post-operative mortality rate for the cardiovascular clinic? And here we're rounding to 1 decimal place. So we set ourselves up. We get our post-operative death rate. We have 3 of the patients that died within 10 days over the number of patients that had a surgical procedure, which was 123. So you kind of see the pattern, okay? So when we get to these mortality rates, it doesn't matter what you see in the front, okay? Keep in mind that you're looking at how many happened over the amount that could have happened, which is usually everything, okay? So in this case, we had 3 patients that died over the 123 patients that had a surgical procedure, okay? The chapter does want you to know the difference between a surgical operation and a surgical procedure. Now, we look at surgical operations. They involve one or more procedure done on a patient at one time, typically for a common purpose or using some type of common approach. A surgical procedure is any single process done on or within the body, mommy makeover, which could be complete on its own. But I wanted to give you some examples. So like with this particular question, I have seen it posed a lot of different ways. Sometimes they give you those 2 definitions, and then you have to figure out which one is which. Sometimes they'll say an appendectomy is a surgical operation or surgical procedure. They may even say a surgical procedure would be considered a mastectomy, true or false. All right, so mastectomy is a surgical operation, not a surgical procedure. Why? Well, it's a surgical removal of one or both breasts, usually to treat breast cancer. So it's invasive. You're doing a lot of different things. You have a lot of surgical instrumentation. All right, so surgical procedure. I want you to think of an IND, also known as an incision and drainage, where we're just making a small little cut into the skin and we're draining out some type of fluid or some type of pus from an abscess. All right, or another surgical procedure would be a colonoscopy. We are not cutting into the body, we're going into a body cavity. Okay, so you're inserting a flexible tube with a camera into the colon to just examine what's going on inside the patient's body. Does that help to make sure you understand the difference between the surgical operation versus a surgical procedure? I have more examples just in case for clarity, but you can give me like a thumbs up if you're good. Awesome. Okay, because I've seen this question posed a lot of different ways. Perfect. The other topic in this particular chapter that they want to bring up is your anesthesia mortality rate. Now, this is a little bit different because this is rare, okay? This isn't something that you're going to hear a lot of. And it says right there, like the ratio of deaths caused by anesthetic agents. But this is so infrequent. This does not happen on a regular basis. With that, we have to understand the 3 types of anesthesia. That is what we use. We have general. We're putting the whole body to sleep. You get your I was about to go into the actual terms, but you have a mask on, they give you gases, they put IVs in you to give you amnesia effect, and then you go to sleep. Your whole body's put to sleep. Then we have a regional anesthesia. where you are removing the ability to feel kind of pain or sensation to a specific region of the body. For those of us that have gone to labor and opted for the epidural, that was me, don't judge me. It's a spinal epidural. That is considered a regional type of anesthesia. And we also have local. I want you to think of, let's say you're going to get your toenail removed. And so they'll just numb areas on the toe so that that area alone is numb. Okay, so general, regional, local. All right. Make sure you have a good way to just differentiate between them. Now, keep in mind that anesthesia mortality is very rare. So you'll notice that we reported as per 1,000 anesthetics administered because of how rare it is. Now, in this example, anesthetics were given 2,000 times to surgical patients, and one patient death was attributed to anesthesia during the past year. What is the anesthesia mortality rate? Well, 1 over 2,000. We report it as 0.050%. But keep in mind, this is very rare. You may get a question that says true or false. Anesthetic mortality is not rare, like literally. And you'll be like, wait a minute. Yes, it is. It's very rare. Okay. So we usually report it as per 1,000. We also get into maternal mortality rate. Now, this is the death of any woman for any cause related to or aggravated by pregnancy or its management. It does not matter the duration or the site of pregnancy, but it can't be from an accidental or incidental cause. Okay, like push down flight of stairs or they were punched. Okay, no. So, an example of an accidental death could include motor vehicle accident. So, okay, so that falls into that not from accidental, right? So those are what we're talking about. An incidental would be suicidal, homicide, anything unexpected or accidental. Okay, so I wanted to point that out so you'll know we're not looking at those specifically. We get into direct versus indirect obstetric death. Now, direct obstetric death is linked directly to pregnancy, like complications during childbirth. Indirect is not caused directly by pregnancy, but influenced by its effects, like an aggravation or a pre-existing condition. And then, of course, the incident happened. When we get into maternal death classifications, only direct obstetric deaths during hospitalization are classified as maternal deaths. I have seen that question before, okay? So it includes cases prepartum and postpartum childbirth. We get into prepartum for childbirth, leaving the hospital in labor without delivering. Postpartum, after childbirth, let's say you developed a infection at a C-section site. And then researchers use different denominators to study occurrences depending on how big or small the population size is. So you want to just make sure you're able to understand the different terms, okay? I believe the chart I sent you kind of broke down those as well as the formulas. Now, getting right into the example, we have University Hospital. A mother died from a hemorrhage immediately after delivery. The hospital's annual obstetrics and gynecology discharges are classified as they delivered 4,782, 297 were aborted, 186 were not delivered or prepartum, 42 days in postpartum, within 42 days there were 46. The number of live births during that period was 4,782. What is the maternal mortality rate? What is the OB case direct fatality rate? And then we're going to be reporting the statistics to 3 decimals. So here we are looking at those fine little details because we're looking at 3 decimal places. Start off with the maternal mortality rate. We have the 1 over 4,782 because remember that one died from a hemorrhage immediately after delivery. Okay, so since we're reporting it to 3 decimal places, we look at 0.20 will be 0.201. I left the 9, but that 9 makes that 001. And then you report it by 100,000, okay? You'll either see an example of the 21 per 100,000 or the 0.021. So just keep that in mind, but it's all about the fine details, okay? Reporting the statistic to 3 decimal places, extremely important. And our lovely program director is here. So like I mentioned, any other information you guys will get, do not stress. You'll know I got y'all. But I do want to turn it over to our lovely program director. Thank you, Mrs. Cotton, for being here.
Oh, I thank you all. I'm sorry to interrupt. And I know that this is just probably the most favorite chapter, is it not? Yeah, I taught this many, many years, and all of these where you do the per 100,000s, and when you get into vital statistics and you've got all these huge numbers. But I have no doubt that Ms. Rulak is getting you set up, and I'm not going to take very long at all. Let's see. If you don't mind, unshare your screen for a second so I can see
Yes.
everyone.
There we go.
I haven't seen your faces in quite a while. I think probably, oh gosh, orientation? Have I seen you since orientation? I know I've communicated with you, but I don't think we've been face to face. So how is everyone? I just had to pop in. You have made it through the middle of your 5th module. Okay. I mean, can you believe that? You've already halfway through, you're over halfway through with the program, and I'm extremely proud of all of you. You made it through midterms for this mod. And okay, but I really popped in to find out, is this statistics course as bad as you thought it would be? Is it? Not compared to mod 1, right? This one actually makes a little sense, don't you think? And I can honestly say I've used these formulas and reported these statistics my entire career. It is just so common because not only do we have to report them to the state for vital records and things like that, but we have to report to our accrediting agencies on any kind of like post-op infections, or unfortunately, we have to report the bad outcomes along with the good. And that's up to us in HIM to do that because we are the ones with all that information at our fingertips. But yeah, I appreciate that it's not one of the most favorite classes in the program, but I'm so proud of all of you. You're doing such a great job, and you made it. You made it through midterms. So awesome. I want to make sure I didn't miss a chat. You're starting to work on these at work. That's great, Melissa. That is awesome. That's not going to do anything but help you on through the rest of the class and on the credential exam. I do want to tell you a little something. You'll have 2 classes with me in Mod 7. I will be prepping you for that RHIT credential exam that you are working towards. And I'll also be helping you through your practicums where you'll be on site, for a short time to actually get hands-on experience with some of this. But great news, you don't have to memorize any of these formulas for the credential exam. Okay, so pay attention to how you pop in the right numbers in the right fields, as far as the numerator and the denominator. but they're going to give you the formulas. Okay. So yes, in person. That is what I try to strive for. I have a list of where all you are located and where you live, and I will confirm that with you the sooner we get to mod 7, because people move, things change, and I totally understand that. But yeah, that's my job. I work on trying to get sites in your area around you to agree to host you as a student. And it's only for 40 hours. So most of the time, students take a week off from work. If they are working full time, they take a week of vacation and go on site and get it all over with in 1 week. Some can work around a day a week for 5 weeks. Say, like, if your employer lets you work maybe 4 10-hour days, or work a weekend day for 5 weeks, and so you can go on Tuesdays, for example. But yes. And there is an option for a remote practicum if that is just not possible, because some jobs won't allow it, and I totally understand that. But I'm going to meet with you guys all next mod for sure. And we're going to talk more about that. We'll actually, the first week of your mod 6, I'll meet with you and we'll have an orientation just for your practicum. And so I'm extremely excited about that. But what I really wanted to do is talk to you a little bit about the program and how it progresses. And I wanted to let you know that, I mean, you have gone through 5.5 mods now, or 4.5, I guess. This mod 5 when you finish, yeah, 4.5. But you're over halfway through with the program. And if you've noticed, things kind of progress a little bit as you advance each mod, right? And so what I wanted to do is to find out your thoughts. I wanted to talk with you a little bit about the way our classes are set up and the way things are currently, and how they may be progressing as you go through the program before you get to mod 7. So first of all, what I'd love to know is how you feel about your courses and about the program so far that you've come through. And this is a safe place, because I can promise you, I know we survey you to death, don't we, with those end of course surveys, but we take every answer to heart. And a lot of the changes that we've made in the program in the past couple of years have been from student suggestions. And when we go back and we look at the numbers, it correlates with what students were saying. And so we change it. And change is not a bad thing. But I'm here for it. Let me just have your thoughts, have your concerns. I don't want to take up all of your time, but we've got time. The knowledge check questions are helpful. That's great.
I did get a question. I don't want to put them on the spot because, people may not want to say
That's,
anything, but
you can just
there,
ask the question. That's
okay,
totally
the
fine.
question about the uh time
Yes,
for the midterm. And I know ours is a little bit different because we are statistics, so they have formulas and different things. So I was like, I
right.
will bring it up.
Yes, absolutely. So the thought process is that with each, a little more time for the midterm. I totally get that. And I will look into it, because the thought behind the progression of the program is, and I hope you've seen this, each module builds on the next. So if you really aren't familiar with the content of the courses in, say, mod 4, when you get to mod 5, it's going to be more difficult to maneuver through those courses. And so when you get to mod 5, what you're learning this mod is going to ensure your success or help with your success in mod 6. So what we are trying to do is find that happy medium where we know that you know what you need to know. So my question I wanted to pose to you tonight is, as a student, how do you feel like you know what you're supposed to know? What what does it take for you to feel like you know something? Is it being able to answer those questions? Is it being able to talk it through in the live session and realize, oh yeah, I am right about that? What makes you feel like you have actually learned what you needed to learn? Mm-hmm. The live session, answering questions, have access to it afterwards. Absolutely. Get good grades on quizzes. Safe Exam Browser was a pain to install. I totally understand that. You're not alone in that. And believe it or not, it wasn't easy for us on our side either. But in all honesty, do you understand why we use the Safe Exam Browser now? I mean, we're all adults, right? But we're all learning virtually. And if we were in a classroom, Ms. Rulak would be handing out a paper test or even administering it on the computer, but there would be no books around. There would be no other tabs open. And that's just, it's integrity. It's academic integrity. So for us to be able to say that we actually teach our students and we have confidence that they know what they're supposed to know, we have to have some safeguards in place. And I'll be quite honest, it has not, to my knowledge, made a big difference because I truly believe that not many of our students are cheating. We have great students. I know we have great instructors. I think we have great students. And so it really, other than the pain of having to load it and having to use it before the exam, and I totally get that, I bet it hasn't stopped you from succeeding, but it gives us some type of safeguard to know that at least we're trying to make sure you know what you need to know. So see, that's another way. How do you feel would be the best way to determine from us that you're learning what you need to learn each week? Like if I were to ask you a specific question and you were to have to answer it right now in person, and I'm not, but would that make you feel like, oh, I can answer that question. I know what I need to know. And if you can't answer it, don't you want to know the right answer? And we're going to do that in prep, you guys. You're going to be with me in prep for the exam, and I'm going to be asking questions, and everyone will be participating and answering questions. And if you don't know the right answer, you will before the end of that night. I mean, it's a win-win. Anything else that may be giving you trouble or that you're concerned about? You might hear my little one in there. She's watching cartoons. Well, I'm just going to tell you, I'm proud of all of you. I think you've done a great job so far. I love this interaction here. I love seeing half of you on camera. That's amazing. From the instructor standpoint, I'm going to just share with you that it can be a little intimidating to sit here and see a lot of dark boxes and no, interaction. That's also a way that I can tell that you are with me, you're hearing me, you're understanding me, because Brittany's up there nodding, Rachel's smiling at me, Melissa's over there and Sharnice is, I mean, it's great to see you and we're connected. That is the whole purpose of a live session, right? I mean, if you're the type of person where you can just read the text and know everything you need to know automatically, then I'm assuming the live sessions don't help much. But for the most part, it's just an integral part of your success each week. And so if you come in the live session, the whole purpose is that interaction, and you've got that. And if for some reason you can't make a live session, let Ms. Rulak know. If you need that one-on-one, she can be there with you one-on-one in a Zoom outside of this 1 hour each week. That's what her office hours are for. And I'm not speaking for her, but I know because she's done it time and time again that she'll meet anytime that you're available, if that's what you need, is that one-on-one. But if you're in the live session, you're communicating, you're participating, you're showing that you know what you need to know that week, then hallelujah. But then if you're not able to make it, that's what the discussion forum is for. So that you go back, you watch that archive, because my goodness, how many of you could make it if you didn't watch the live session or the archive each week? That archive, I know some of my students, even in Mod 7 this time, they go back and watch the archive, even if they were in the live session, because we go over so many questions and we go over so much content. And it's so great to have that recording there. So yeah, absolutely. If you're not able to be in a live session, not a problem. That's part of online learning and being an adult learner. But that archive is there for you. And then the discussion forum, it's not an extra assignment that we want to just give you. It's to see if you are getting what you needed from that live session. That's the only way we have to communicate with each other. Better understanding? Absolutely. I agree too. And I enjoy the live sessions because it makes me feel like I get to know everyone just a little bit deeper. And as you've seen, you've got instructors through mod after mod after mod, and those relationships form. And hopefully they've formed with each other. You guys are a very good cohort. So I hope that you've kind of at least gotten some relationships. HIM field is it's very open, but it's also very tight knit. So you never know. You guys might see each other at national meetings. You may work with each other one day, even remotely for a company, and you live in different states. So trust me, networking is the best, the best. Anything else, you guys? I didn't want to come in and just talk, talk, talk because I can talk. I am from the South and I can talk. You're a quiet class. I totally get that as well. No problem, because I'll fill in I'll fill in the gaps when we're in the live sessions, but you'll have to talk to me then because we will be pounding out those questions. But I want you to know we're here for you. The two things that in orientation, all day, me too. Me too. But in orientation, I try and say the two things that will make you succeed without a shadow of a doubt in this program is first off, communication with your instructors and me. And secondly, don't get behind. Because as you've seen, 11 weeks is not a long time. And when you get behind, it's hard to catch up. But even if life happens, life happens. Let us know. Let us know what's going on with you. Let us know what's coming up, even, and we'll work around it and through it and get over it. We will get over it together. But just keep us updated and informed. And if something stresses you, I don't want you to be stressed. I want you to tell me so that we can find a solution. Okay? All right. Well, Ms. Rulak, I did not want to take up too much time so that you could get back into that joyous. I saw it was maternity. Was it, are you on vital stats or is it autopsies this week?
This week's well, we are still doing mortality,
Uh-huh.
newborn
Uh-huh.
mortality rates, what we're getting into, and then we're gonna have autopsies touch on it a little bit, and of course I'll
Yes.
give them some extra information
Yes. And
afterwards.
again, you won't have to memorize those those formulas, okay? Just get used to, like I said, inputting the numbers or the right numbers, pulling those from the table, putting them in the right spot, and you cannot fail. Walking through that formula is the best trick in the book. It's the only way to do it, really. But okay, well, congrats about making it through midterms. Again, proud, proud, proud. I can't wait to continue the journey with you. I'll be meeting with you next month, the very first week, to talk about your practicums. Okay. So I hope you all have a great rest of the evening, and I will talk with you soon. Thanks,
Thank
Ms.
you.
Rulak. I
Thank you,
appreciate
Ms.
it.
Cotton. Yes, ma'am.
All
Thank you.
right. Bye.
Bye. Okay.
I forgot two things. Two things, the main things I wanted to tell you guys. And it's like, but I saw your sweet faces and I just got all in my feelings. But anyway, first off is I know that the time limits are a concern. Okay. And I want you to know that we are looking at data, we are looking at time limits, and that is one of the as you progress through the program, you're supposed to be able to recall this information and answer these questions quicker. That is a safeguard. However, if you're having to calculate a formula, it's different. So we are looking into that. Please, if for some reason you don't do well on a quiz, don't just say, oh, well, I ran out of time. Let Ms. Rulak know. Let your other instructors know. They will let me know, and we will work through it, and I will fix it. Okay, we will fix this, and we'll get through this process. Okay. The second thing is that I know that you have had quizzes and knowledge checks where you have matching questions, you know, where the question might be 4 to 6 terms and you've got to match those terms with their definitions. After this module, they will no longer be in your knowledge check or quiz banks, okay? So if that is a reason that you stumble and don't get the grade you think you need or that you want, let Ms. Rulak know the rest of this mod, let your other instructors know the rest of this mod, and we will address it, okay? But yeah, as of next mod, you will not. A matter of fact, that is one thing that we have done in mod 6 and 7
Mm.
is we have thinned out question banks and made the questions extremely cohesive, what you need to know each week. So, and that's another thing that it actually will be different next mod, but it's a good thing. Your knowledge checks, you won't have like unlimited attempts at them because every attempt won't be different because the question banks are going to be much smaller. So we will absolutely get into more of that when the mod starts next mod, but that's all about us wanting to make sure that you know what you need to know. So rather than having 60 questions you have to cycle through to possibly have on a quiz, there aren't going to be that many. And so you'll have 2 attempts at your knowledge check and you'll be able to sufficiently have a good grade on your quizzes.
Mhm.
Okay, yes, Melissa, that's a good question. Is it 3 classes each mod? Mod 6 is 3 classes. Mod 7 is actually, it looks like 4 classes, but it's only 2. Okay, so you have a class with Ms. White and Ms. Garrett that you will have on leadership management, how to be a boss with Ms. White, and the reimbursement course that brings all of your coding together and shows how we get paid. Okay, so that one's going to tie together in mod 7. The other 2 classes are where you'll go on your practicum and the RHIT prep, and they're different. They're not like knowledge checks, exercises, quizzes. I mean, there's an assignment each week, but it's not at all like your other courses. So even though it looks like it's going to be a busy module, it's not. I promise. It's certainly not any more than what you're doing right now, for sure. Okay. The HIT exam, the RHIT exam, you will take that before you graduate. Oh yeah,
You'll be
that will
ready.
be,
You guys are gonna be good. Trust.
yeah, you're gonna
Trust.
be good. You're gonna be great. And Rachel, I hope you're talking to someone else because that face that she just made was like, no, what? No. Anyway, that's funny. Yes, and I'm gonna make sure that you're ready. Your instructors are already making sure that you're ready. They're asking you questions that are coming straight from the RHIT prep book that I'm going to be using with you. And I mean, you're getting speckled with things all throughout the program. I promise you, you're going to have everything you need to succeed. I promise. All you have to do is use it. Use us, you know. That's what we're here for. But okay, I'm sorry, I apologize again, but I didn't want to not tell you that because I wanted you to know that you know, so light is coming across the horizon. On the exam, you don't have to score anything on the exam to graduate. Okay, I am not putting you passing that credential exam. Your degree is not going to hinge on that. You pass these courses, you're getting that degree. Okay, so there is no score. You don't have to pass it. I want you to take it the week of finals or before because you're never going to be more prepared than you are right then. At the conclusion of all your coursework and at the conclusion of going through domain, domain. There are 6 domains that are covered on the exam. We're going to dive into each one of them. And at the end of mod 7, you'll never be more ready to take it than right then. Okay. And that in that course, I'm going to walk you through registration, scheduling, everything. And I'll have a code that you'll use to pay for it. It's going to be an easy process. And you'll have some practices where you won't, the first time you sit for 3 hours to answer 150 questions will not be at the exam itself. You're going to practice because that takes its toll on your mind, your emotions, and even your hiney, you know, sitting that long. So I can promise you, you'll be prepared. Okay.
There was another question, is the test online?
It is. It's not from home. You have to go to a testing center, but it's all on a computer. So you do get a score immediately, and it's all computerized. They're all multiple choice. And so if there is a calculation, then they will provide that formula. If there is a coding question, you will not need your code books. They'll actually provide snippets from the code book for you to search and find the right code. So you'll not have to take a physical book with you to the exam. They'll give you everything, even a calculator, in the test. Okay. I just cannot wait for you guys to move on. Okay, I'm leaving. I'm going, but
Wow. I
if you
want to
want to
enjoy them
check,
a little bit longer,
I know, right? I
but I
I
know they want to
really
graduate.
I know. That's right. That's right. What grade do you have to have? Oh, I was going to tell you the test itself is 150 questions. The potential perfect score is 400. To pass, you have to have a 300 or more. So it's basically 75%. So your score, that when you get the score sheet, it's going to say your score is 300 or 350 or 310, whatever. But as long as it's 300 or higher, it's going to say, congratulations, you passed. And I'm sure they all will. So, all right, with that, I am out of here this time for sure, for good. Thank you all again. Sorry, Ms. Rulac,
No,
but
you're fine, ma'am. Thank
yeah,
you.
I will see you again before too long.
Yes, ma'am.